But to talk about some of the key side effects of the hormone treatment, there is an increased risk of some cardiovascular side effects as a result of this. So people that have heart issues up front, it's definitely important to, make sure that, your cardiologist or heart doctor is aware, of you going on to hormonal treatment, and making sure they don't need to make any adjustments as a result of you going on to it. An increased risk of fractures. Most of these are typically longer term side effects, I would say, but it's something that you definitely, want to discuss. In terms of the risk of fractures, the thing that I definitely tell patients is that, we are basically taking away your testosterone, and as a result of that, your bones can become a little bit weaker. That may lead to an increased risk of fractures. So I recommend that all my patients be on calcium and vitamin D if they're able to take that, and do some form of weight-bearing exercise, swimming, on stationary bike, something that they're putting some resistance against as well. And typically, we would recommend a bone scan, called a DEXA scan. That's a bone density scan, that would measure the strength of your bones every 2 years, typically, if you're going to be on the treatment for a long term, or longer term. And then some people, may have some mood changes, decrease in libido, and then some hot flashes and weight gain and increased appetite as a result of this as well. So those are some things that, we tell people that they may potentially encounter. And again, all this sort of depends on, the length of time that you will be on the treatment. And that can be variable based on your specific type of prostate cancer. Some we keep people on the hormone treatment for up to, 2 years. Others are just for a shorter amount of time. So I think it varies in terms of, how long are you going to be on the treatment, of what your side effects may be as a result of that as well.